Mr. Johnson. I'm Madeline. I will be your student nurse today. Can you go ahead and state your name and date of birth? Okay, and I'm just going to check the armband to make sure that matches, which it does. Okay, so today I'm going to be inserting a nasogastric tube. And so what I'm going to do, this is going to be inserted through your nose down to the stomach. I'm going to make sure I walk you through the entire procedure, and we will use measures to make sure it is as comfortable as possible. Can you start by telling me if you have any allergies? Okay. Do you have any cultural or religious concerns you would like me to know about before we begin? Okay. Do you know if you've ever had any facial surgeries, any trauma to the face, or if you have a deviated septum? Okay, so I'm just going to go ahead and perform hand hygiene. I'm going to provide you with some privacy. And now I'm going to go ahead and check your nose to choose where we're going to insert. Okay, so we will insert on the right side. So now I'm going to position you into a high collards position, and I'm going to put a pillow behind you, and you're just going to move your head just a little bit back. Your neck is going to be extended just a little bit back onto that pillow. Okay, now I'm going to, and during this process, if you could just tap me on the wrist 2 times if it gets to be too uncomfortable for you, and that will signal for me to stop. Okay, so I'm going to go ahead and prepare my tape, which I have already done, and then I'm going to put on my clean gloves. Okay, now I'm going to measure the length of the tube. So to do this, I'm going to go from the nose to the earlobe and then to the xiphoid process. Okay. And I will mark that. Okay. Now I'm just going to begin to kind of coil this so it goes down the patient's nose. Okay. And then I'm going to lubricate as well. Okay, so I will lubricate that. Okay, so now I'm going to hand the patient a basin and then a glass of water with a straw as well. Okay, so for this first part, I'm just going to have you slightly tilt your neck back. Okay, and remember just to tap me 2 times in case it gets to be too uncomfortable for you. Okay, so I'm going to start to insert. Okay, and for this next part, I'm going to have you extend your face down to your chest, and I'm going to go ahead and hand you your glass of water, and I'm going to have you take a sip of water, and I'm going to insert that tube as I insert. Okay, so take a sip of water, swallow, take a sip of water, swallow, take a sip of water, swallow. Okay, so now that I have that inserted all the way, I'm going to go ahead and tape this to the patient's face. So I will just temporarily tape that to the side of their face. Okay, and now I'm going to check the location of the tubing. So if I could get you to open your mouth for me and say, ah, okay, and can you state your name for me? Okay, so I see there's no coiling in the throat. Now I am going to check with my stethoscope. I'm going to listen to the lung sounds. Okay, everything is good there. Then I am going going to withdraw 10 milliliters of the gastric. And so I'm just going to draw up that 10 milliliters. Okay. I'm then going to test the pH of this. So I would insert this into my cup and then take a pH strip to check the pH of that. Okay, so that pH is normal. So now that we've done that, we can go ahead and close the tubing. Okay, so now I'm going to tape the tube to the patient's nose. So I'm going to remove that temporary tape. And I'll tape that over the patient's nose. And then I'm going to take my tape and just twist that around the tubing. Okay. Now I'm going to take my second piece of tape and just tape that over the bridge of the nose. Okay. And now I am going to have the patient turn his head to the left so I can measure how much room he'll have to be able to move around with the tubing. Okay, so if you can move your head to the left for me. Okay, and then I'm going to pin this to the patient's gown. Okay. Okay, so now that that is done, I'm just going to make sure the patient is comfortable. Okay, so Mr. Johnson, are you comfortable? Is there anything that I can get for you before I go? Okay. Are you comfortable, not experiencing any pain? Okay. I'm then going to position the patient in the bed, and I'm going to make sure his call light is available for him, and then I'm going to take off my gloves and perform hand hygiene.